The treacherous effects of lung cancer.
One evening, an immature individual was smoking a cigarette outside a library. He's 20 years old and living with his father. He started smoking after peer pressure from his friends. All of a sudden,
Son! No! 911! Come quick! My son collapsed. He was smoking a cigar. Come to the Monroe Township Public Library.
The ambulance arrives within 2 minutes and starts to drive dangerously fast through the streets. The doctor starts to examine the body of the patient and uses an oxygen mask to keep his breathing steady. The patient is taken to a room and takes an imaging test and a CT scan. Imaging testing produces an X-ray image of your lungs that may reveal an abnormal mass or nodule. A CT scan can reveal small lesions in your lungs that might not be detected on an X-ray. Other forms of diagnosis are sputum cytology or biopsies, and doctors perform them in many ways. Once diagnosed, the doctor would determine the extent of your cancer. Staging tests may include imaging procedures that allow the doctor to find evidence that cancer has spread beyond the lungs. These include CT, MRI, position emission tomography, and bone scans. The father is waiting and watching anxiously. The doctor walks out of the room and goes to the father to share the bad news.
Doctor, is everything okay?
Unfortunately, after taking the imaging test and CT scan, it has shown that your son has stage 3 lung cancer. After diagnosis, your son can live for around 5 years.
Many people get regular treatments to lung cancer with the help of chemotherapy, radiation therapy, or other therapies to try to control the cancer as long as possible. Most cancer treatments have side effects that last for a few days to weeks. Other surgeries can be performed to battle against lung cancer. Radiation and external radiation therapy is the use of high-energy radiation to kill cancer cells and to shrink tumors. These treatments are painless and usually last a few minutes. Chemotherapy, however, is different from other treatments because instead of targeting one area of the body, chemotherapy goes through the entire body in search of cancer cells. Targeted therapy is similar to chemotherapy in the sense that it searches through the body in search of tumor cells. This uses drugs that target specific parts of cancer cells or nearby cells that help them grow. Immunotherapy is a new cancer treatment approach that uses drugs, vaccines, and other types of therapies to activate the immune system's natural defenses so it can fight cancer.
If you do the radiation therapy, I want to do it as soon as possible.
Chemotherapy and radiation therapy can be done right now because of the severe condition, and it must be treated immediately.
Thank you so much, doctor. What are the symptoms of lung cancer?
Some symptoms of lung cancer include chest pain, wheezing, tiredness, shortness of breath, and weight loss.
The symptoms above may occur due to other illnesses as well. Therefore, it is recommended to speak with your doctor to help find the cause. There are different symptoms for lung cancer depending on the person. Some have lung cancer which has spread to other parts of the body.
Son, is everything okay?
No. So tired. My chest hurts so much. I can barely breathe.
You know, the doctors told me about these symptoms. I paid for your radiation therapy to help treat your cancer.
Lung cancer is uncontrolled growth of abnormal cells in your lungs. Lung cancer is developed in the lungs once the lung cells mutate, change their natural growth and death cycle. This results in an excess amount of cells being produced. These rapid growing cells wouldn't perform the functions a normal lung cell would need to perform, and they wouldn't develop into a healthy cell tissue. The lungs inherit lung masses, also known as tumors. These are visible through X-rays and CT scans. Lung cancer causes permanent damage to the DNA sequence. There are many causes to lung cancer, but the number one cause is smoking cigarettes. Other factors can increase the risk of developing lung cancer, such as exposure to secondhand smoking, if you have undergone radiation therapy in the past for a different type of cancer, exposure to radon gas, or having a family history of lung cancer, such as a parent or a sibling. There are many ways to prevent lung cancer, but the number one way is that if you're smoking, you should stop smoking and to eat a healthier diet. Other ways to prevent yourself from developing lung cancer is to test your home for radon, because when you breathe in radon gas, some particles can get trapped in your lungs, which increases the risk of lung cancer, and to avoid toxic chemicals.
Lung cancer is found in most people 65 and older. Lung cancer is the third highest occurring cancer.
However, a very small amount of cases occur in people under the age of 45. Black men are about 12% more likely to develop lung cancer than white men, and the rate for black women is 16% lower than in white women. People who smoke have a 15 to 30% increase in chance to get lung cancer. However, adults who are exposed to secondhand smoking increase their risk of lung cancer by 20 to 30%. We learned while researching lung cancer that race is a factor that can impact the rate of getting this cancer. Most lung cancer statistics done by researchers include small cell lung cancer and non-small cell lung cancer. About 10 to 15% of lung cancers are small cell lung cancer, while the rest of the 80 to 85% are non-small cell lung cancers. The 2023 U.S. lung cancer statistics include about 238,340 new cases of lung cancer and about 127,070 deaths from lung cancer so far.
Make sure to have your son quit smoking and cause further damage to his lungs. It's not going to be easy at first, but at the end it's going to be worth it.
Thank you, doctor. I'll make sure of it.